here at SSM Health Cardinal Glennon Children's Hospital, the original Glennon, OG, as we lovingly call her, she has served this community for 70 years. So we wanted to make sure that we were true to that legacy as we transition to a new building and make sure that we continue that same mission for more than 70 years in the future in the new building. And then they came to the design, and that's where we go back to what I talked about earlier, the inclusivity and the listening. Yes, I'm supposed to lead this, but there's so many people that are going to be in that hospital day to day that needed to have that voice. So starting with our physicians, nurses, environmental staff, our cafeteria folks, patients, families, parents, everyone was brought around the table and allowed to bring in their insights, their views, because they were going to be using this hospital day in and day out.
It takes something a little more to lead with impact. I'm Lisa Nichols, author of Something Extra, and this podcast was inspired by our daughter Allie, whose additional chromosome has shaped how I see people in leadership. Each episode features conversations with inspiring leaders from around the world about what truly defines how they lead and serve others. If you enjoyed today's conversation, please consider leaving a 5-star review. It helps more people discover the show. And if you'd like to go deeper, my book, Something Extra, is available on Amazon and through other major book retailers. Dr. Hossain Marandi is an Iranian refugee who escaped the 1979 revolution on foot with his family. An experience that instilled a lifelong devotion to Catholic healthcare ministries due to the radical generosity that the church showed his family. Now serving as the president of SSM Health Cardinal Glennon, he moved his family to St. Louis to help design a brand new family-centered 14-story children's hospital from the ground up. Well, Dr. Marandi, I have been looking so forward to this conversation with you. Thank you so much for making the time to be on the show today. I cannot wait for our listeners to learn more about your story, learn more about Cardinal Glennon and the vision. You guys have a lot of things happening there, don't you?
We do, and thank you very much for the time. I'm really excited to be able to talk about my journey here to Cardinal Glennon and really spend time on talking about the great services and the devotion that we have to the community and to children's healthcare here at Cardinal Glennon Children's Hospital.
Yeah, it really truly is remarkable. My dear friend Susan Conrad is on your board,
Yes.
and she invited me recently to a presentation that you did. And I was just so blown away by everything. I mean, I learned a lot that I didn't know, and I'm right here in St. Louis, so I'm just excited for our listeners to learn from you today. But you truly have one of the most remarkable life stories that I have encountered. I mean, you really do. Can
Thank you.
you take us back? I mean, because you grew up in Iran, can you take us back to growing up and some of your memories and some of the things that happened there?
Sure. Sure. I have to start off by saying that Susan is a wonderful, wonderful person, wonderful human being. We're really excited to have her as part of our board. Um, I usually don't like to talk a lot about myself because it's really the organization and the calling that I'd like to talk about. But I'll take your listeners back a little bit to my past. Uh, as I think through my journey to get here, as you mentioned, I was originally born and raised in the Middle East in Iran. I was a very sick child myself growing up, always in the hospital, always at the doctor's office. And my first mentor, or I would say, was my pediatrician, who also happened to be my uncle and my next door neighbor. So it was perfect opportunity for that person to really shape my life and who I became later on. Knowing that I spent so much time being sick myself, I knew that my calling was to grow up and help other children feel better. So that was always the impetus of what I wanted to do. Uh, Obviously, growing up in poor in the Middle East, not the biggest opportunity to be able to grow and to get into that field. So as I continued to grow up there in Iran, Obviously, something big happened back in 1979, the Islamic Revolution that completely changed everyone's life, including myself. My family was ostracized for many reasons after that revolution, and my father knew that in order for myself and my sister to have a future, and for us to be safe and to be able to grow up to be good members of society, we needed to leave. And at that time, my family decided to pack up everything and escape from Iran. And it was literally escaping from Iran, having to pay smugglers to smuggle you across the border into other countries and hope for the best. So my family did exactly that, just like many other families of Persian descent during that time that left the country. We ended up in Afghanistan, later on in Pakistan, and had the opportunity to go to Spain as refugees after a while. So my family flew out to Spain and was placed in a kind of a refugee camp with many others who had come to Spain at that time. So we were in Madrid, and that's when really you think back about everything that's happened in your life, and sometimes you look at all the things and think that it was a negative, but everything had a purpose. And when you think back at that time, where we were situated there in Madrid, the place was right next door to a Catholic church. And
Mm.
my younger sister, Mary, we would go by the church to get clothes, food, just like anybody that is in need reaches out to the church, and we did that. Interestingly, the head sister at that church was also Sister Mary. And Sister Mary and my sister Mary got to be really good friends, and they got to sit there and they would play with dolls. And I still remember the two of them. And when Sister Mary and the Catholic Church heard the our plight of what we had gone through and what we were trying to do, which is to be able to find a way to come to the United States, the Catholic Church there sponsored my family to become refugees. And that one moment of grace and time really shaped the rest of my life. So we were able to leave Spain and come to the United States as political refugees. And that moment in time allowed me to shape the rest of my career. Obviously, having the opportunity to come to the United States and make something out of myself. I always say I am the poster child for the American
Yes.
dream, what every person across the world dreams of being able to do and make something out of themselves by coming to the United States. So, coming here, um, that moment in time, again, it gave me the opportunity to pursue my calling in life, which was to become a pediatrician and to help children. It gave me the opportunity to be able to give back to the Catholic Church. So I have spent almost every minute of my career since graduating by giving back to the Catholic Church. So I've only worked in Catholic organizations throughout, be it from St. Joseph's to St. Vincent's and now Fascinating Sisters of Mary. It has been a calling for me to be able to give back for what the church did for me and my family. So lots of things along the way that have allowed me to be who I am today. Lots of people that went out of their way to help me, help my family when we came here to the United States. Uh, I remember starting seventh grade here. All I knew were yes, no, hello, goodbye, and my name is Hossain. That's the extent of the English that
That's
I
the
knew.
extent of the English language.
So I still remember my civics teacher. She pulled me aside and said, "I'm going to teach you English." And she would stay before school and after school every day. And she taught me English, taught me how to write, taught me how to write cursive. So I think of Mrs. Henderson who did that, and so many other Mrs. Hendersons along the way that have helped me and my family get to where we are today, and for me especially to be the person that I am today.
That is such a remarkable story and so inspiring, Dr. Randy. Just like you said, being the poster child, I mean, really, the things that you went through could have taken you out. But the Sister Mary and Miss Henderson, those angels along the way, um, really, shaped you and gave you such a better opportunity. I love the story so much. And to your point, you are giving back. You are giving back. And I love it that you found your purpose through that. Even like being sick as a child,
Mhm.
that is an awful thing. But, you saw the need for good health care for children, and that's what really inspired you. So sometimes I think our hardships are the things that cause us to grow the most and to figure out who we are, right? So,
Agreed, 100%. I think when you think back of those times, you always think about the negative aspect of things. But a lot of times, if you step back and think back, especially to those days, it wasn't rejection. It was always redirection. It was always a way to be able to take that next step. And for me, I knew that the calling was to help kids. I knew that I
mhm,
wanted to take care of kids that were in my place. And I knew that I had the gifts to be able to do that. And I've continued to look for ways to be able to give back to society as a whole and to kids. Uh, Kids really do not have a voice, and we have to be their voice. And I think
yeah.
that's been one of the big things that I've been able to do is to really look at it from their perspective and their eyes, and make sure that we address some of the things that kids need and be that voice wherever that can be heard.
That's beautiful. That's beautiful. Well, I just want to reiterate one thing. I love you just said a nugget of gold there. You said reframe it. It's a mindset shift from rejection to redirection.
Correct. Correct.
And I think that that is just something that we can all take away. Well, let me ask you this. Medicine, it's demanding, right? Leadership is demanding. Why did you choose both of those? Now, I mean, you're a pediatrician, but also now you're leading as the president of Cardinal Glennon Hospital. What was that shift for you when you thought, no, I want to go into administration? I wanted to go more into the management side.
So as I think back, I knew that the calling was to be able to help kids, and I knew that I wanted to be a pediatrician. Never wanted to do anything else but that. Obviously, had the opportunity to come to the United States. I got a chance to go and get my degree at University of Tennessee at Memphis. Followed that by training down in South Florida, University of South Florida, and Johns Hopkins All Children's. That gave
Mhm.
me the foundation to be able to help kids. Practiced for many years, and I loved what I did. That was what I was built for. I was built to help kids. Yet I understood that there were two things that were pulling me into a different direction. Number one, I wanted to do more than just the one on one in the office. I knew that I wanted to make a more positive effect on children's lives on a larger scale than just the one on one in the office. And I realized that the only way I could do that was in roles that I sit in now, to be able to have a larger voice to help more children in the community that I would not have had before. Add to that was I had a skill set that I realized that was very different from my colleagues. I actually enjoyed the administrative side of medicine. I enjoyed the
Mhm.
business side and the financial, and I enjoyed doing those things. Yet I knew that it took me many years to become a physician. I knew that I was not going to become an administrator and a hospital president overnight either. And I had to go pay those dues and be able to get that education. So very early on, when I finished my training while I was still working as a pediatrician, I went back and got my business degree and started doing almost a second job during the days and nights where I had the opportunity by working inside the hospital. I actually begged the hospital president and this chief medical officer, is there anything you have for me to do? And I think after 2 years of begging, they finally got tired of it and said, yes, here's some things for you to do. That
Mhm.
was the step in to be able to learn. I had to be able to learn, just like I went to
Sure.
high school, college, medical school, and residency. I had to do that same travel through the administrative piece of it. And I knew that I wanted to become a hospital president to get that opportunity to be that voice for children on a larger scale. So that's what I did. Spend many years learning the craft, learning how to be a true leader, understanding how administration and the business side of medicine work, and combine that with the clinical background that I had, it gave me an opportunity to be a bridge between not only the clinicians and the administrators and be able to sit at both tables and be able to bring them together, all understanding that there was a mission, which is do good for kids. So that's kind of become my goal in life going forward.
I love it. I love it. Well, I want to get into Cardinal Glennon because what really attracted you is all the vision that Cardinal Glennon has, and for you to be in on the ground floor of that, right? I think you're the first physician to lead Cardinal Glennon since the founders,
Uh,
the first physician,
I believe so. I'm not
which
100% sure, but I believe so. Yes, it's
I,
very rare. I think when you look across the country, the thousands and thousands of hospitals, I believe only 5% of them have a physician as the leader of those. It is rare because many
mhm,
of us either don't have the interest or the true understanding of how to be that leader. So it is rare, and again, I'm proud that I can bring both the clinical lens as well as the
yes.
administrative lens to this.
Yeah, I think those two perspectives together are really powerful. I mean, you understand at the bedside of what it's like, right, to treat a patient. So, um, I want to get into a little bit more about Cardinal Glennon,
Yes,
and then we need to take a quick break. But let me ask you about this. Children really don't care about titles. they,
agreed.
they do not care about titles, right? They care about trust. And what has like treating children really taught you about leadership, Dr. Marandi?
So I would say one of the things that you hear a lot through the mouth of babes, they will
Yes.
be very open to tell you how they feel. You know where you stand with the child because there's no filter there. I think one of the things that I realized in leadership that I wanted to make sure that I brought to the forefront was that transparency. Um,
Mm,
Being able to talk through why, what is the problem, what am I seeing, what I'm trying to do with it, but also open up that transparency for everyone else to be able to see it and lend in their point of view into that. So I think that's the biggest thing when I look at dealing with children. It's being about as open with them as you
yeah.
can be,
Yeah.
um, because that's how they're going to be. They have no filter to see it that way. And I wanted to make sure that when I was in residency and in practice, I remember trying to lean into the administrative side, and I was told, stick to what you know, medicine. You don't understand business, and that was always a bit hurtful, but
Mm-hmm.
it was true because I didn't know it. But if somebody had taken the time to help me understand it, I think I'm a pretty smart person, and many people that we deal with in this healthcare organizations are very smart
Are very
people.
smart,
So
right?
why not be able to
Yes.
share that? So I always wanted to be inclusive as well as transparent in the things that I do.
Yeah. Oh, that's so good. Well, let me ask you this. Um, how do you, because you're dealing with families and that are going through very uncertain, scary times,
Yes.
very scary times. I mean, how do you lead personally through that uncertainty and to give those families hope? I mean, what do you do to navigate that? Because I know that's got to be so difficult.
It is difficult. Leadership is not easy. I know one of my mentors said it, and I'm sure it's been written somewhere. If you want to be a leader, don't expect to be liked. If you want to be liked, go sell ice cream. It is a
That's good.
tough position to be in. Uh, I I would say I leaned back on the way I practiced. I always wanted to make sure that number one, I gave the parents and the child enough ability to tell me their view, taking that information, process it, tell them what I think, is happening, and here's what I'm expecting to do for it, and this is what you should expect from it. And I've taken that into the administrative point of view. I always want to listen to hear the other side. I always want to understand the perspective of the other side, because it's very easy as a leader to just say, well, just here's my way.
Mm-hmm.
That's not the way it really works. To be able to understand the other side makes a big difference, and I think many people like to be able to hear that. Same thing when it comes to the parents. I can go in as a physician and as an administrator and tell them, here's how it is. That's not really helping them. If I want to be able to understand what they understand, what do you
Mm-hmm.
think is going on? What are the concerns that you have? I still have the opportunity to sometimes work with our learners. I love to be, somebody took the time to teach me, so I like to be able to be involved. And I tell them that might be the thousandth, 10,000th ear infection that I've seen. To me, it's another ear infection that's easy to treat. But to that first time mom, that's their child, and that's the first time they had to deal with it. You have to understand her perspective rather than
Mm-hmm.
yours. If you go in there and say, oh, it's just another ear infection. No,
Right.
it's
It's right.
very important. So I think really for families is to be able to understand where they are, understand where they're coming from, understand the challenges that they have. It's not easy having a child in the hospital.
No.
There are many things that are challenging to our families. Um, Understanding that and weaving in how can we help that as well as the medical aspect of it.
Yeah, that's so good. Well, what I hear you saying is that you ask a lot of questions
I
and you listen.
Yes,
It's not just telling, right? What
yes,
you think or what your perspective is. Let me ask you one more question, then we're going to take a quick break.
sure.
Um, what, and I know that this is your heart, Dr. Randy, you're a servant leader. What does a servant leadership look like in a children's hospital?
I don't think it's specifically to a children's hospital. I think when you've been given the honor of leading others,
Mm,
it's the concept that that is what you're doing. It is not about you anymore. It's about everybody else. It's the high emotional quotient and the low what's in it for me attitude. It's not about you anymore. It's about the others, and it's about the mission. It's about the vision. It's about the other people that you're doing. You're just a vessel to be able to make that happen. So to me, it's always been understanding the humility that it takes to be a leader. Because if you're making it about yourself, then you're in the wrong business.
you're in the wrong business. That's right. It's about servant leadership, I think, is about serving
Yes, yes.
and stewardship,
It is
is what I
about,
say.
it's
Yes,
always about someone else. The
yes,
personal joy that I get is by seeing the things that happen and the services that others receive, and understanding that at night I can look back and say I did something to help someone else. And
yeah.
that's the reward that you get. It's not what you got in return for that.
That's so good. Well, we're going to take a quick break and then we'll be right back on the Something Extra podcast with Dr. Marandi.
Hey there. In a challenging business climate like this, savvy leaders look to technology to find an edge. This can mean the difference between staying ahead of the curve or playing catch up. It's time to collaborate with the highly skilled experts at Technology Partners. Our team of technologists draws upon decades of experience for your project, with each bringing a passion for solving problems and a track record of success. How can we help you overcome your biggest technology challenges? Visit technologypartners.net to book a free consultation with one of our leaders.
So, welcome back, everyone, to the Something Extra podcast with Dr. Marandi. So, Dr. Marandi, I know that you have intentionally worked with Catholic healthcare. We've already talked about that. You've been with some iconic systems over the years. But tell me about your faith and how your faith has evolved through the years.
Thinking back to as I mentioned earlier about the history of me and my family leaving Iran after the revolution, and partly that was because of the ostracization of uh, views and thoughts. of
Mm-hmm.
trying to force everyone to have one view and one thought. And my parents had always been very open and very um, much of a teacher to me around all faiths and understanding and the ability to be able to honor and be respectful to all faiths. So that kind of led me to continue to grow spiritually as I have throughout the years, because the work that I do, understanding very early on that it was no longer about me, that I was a vessel to be able to provide that, and that only comes through a higher power. It's someone
Yes.
that commands you to drive you into doing things. It's looking back at all those times where I thought something bad was happening, but I was actually being redirected. That doesn't happen by just luck. It is a foretold story of someone that's trying to direct you into. So I look at everything, and even here, being here at SSM Health Cardinal Glennon Children's Hospital for the past 3 years, there was a reason why I ended up here. That was the direction that I needed to go. That's why I was placed here. So I think back at everywhere that I've been throughout my life, and every moment in time, it's been because I have been directed into the next, because I have a purpose, and my purpose is to care for kids. So
Mm-hmm.
it just allows me to be more grounded, allows me to be more open, more able to listen, able to understand, and just be able to do the work that I do, knowing that it's not about me; it's about a much larger uh, aspect of this world, and that only comes through faith. And that's what you can always fall back on. Whenever there's a challenging day, you fall back on it.
Yes.
Whenever there's a challenging thing that comes up, you fall back on it, and it always works out.
Well, we share that because I mean, it is the anchor for my soul.
Yeah.
I would be tossed to and fro if it weren't for my faith. Something that you said, Dr. Randy, that really resonated with me. You just said, I'm just a vessel.
Mhm.
We're a vessel, right? And
Correct.
so, but to be a vessel that can be used, we need to be poured out.
Yes.
And then, so the
Yes.
spirit, can be poured in. And it reminded me of Mother Teresa.
Mhm.
And one of my favorite quotes from her was, I'm just a pencil. And you know this quote,
Mhm.
I'm a pencil in the hand of God.
Right.
And, I love that so much. We're just vessels. Well, I'm so excited. I want you now to talk about Cardinal Glennon. I mean, this, this is going to be such a beautiful hospital, 500,000 square foot hospital, 14 stories, probably one of the largest philanthropic healthcare initiatives in St. Louis, I would say, for as long as I can remember. But tell me more. You helped design this.
Mhm.
You helped design this new family-centered children's hospital. What do you want families to feel the moment that they walk through those doors, Dr. Marandi?
That's a great question. I think back when I was approached about this role, and I talked about being directed. That's exactly how I felt. Coming here to St. Louis and being able to be in this role really went back to that faith that we talked about, and I was directed to be here because of this project. So I see it as a calling to be able to make sure that we leave this organization and this community with the best access to the world-class pediatric care that it deserves. So it started out with the Children's Hospital, and that's exactly what it is. I was brought here to help design it, build it, and make sure that it opens on time. Uh, and it is. We are
You're on track.
on track. Will be completed by July of 27 next year, and we are expected to see first patient October 22nd of 27, which is not very far from today. So when you look at the new Children's Hospital, we here at SSM Health Cardinal Glennon Children's Hospital, the original Glennon, OG, as we lovingly call her, she has served this community for 70 years. So we wanted to make sure that we were true to that legacy as we transition to a new building, and make sure that we continue that same mission for more than 70 years in the future in the new building. So when you look at just even the selection of the location of this hospital, we moved just 2 blocks down the street and we're still here because when we look at the population that we serve, this is where we need to be. We don't need to be out west. We don't need to be farther away. We need to be here because the patients and the families that need us and that have depended on us for 7 years are here. So that's what the decision was made to stay here. And then they came to the design, and that's where we go back to what I talked about earlier, the inclusivity and the listening. Yes, I'm supposed to lead this, but there's so many people that are going to be in that hospital day to day that needed to have that voice. So starting with our physicians, nurses, environmental staff, our cafeteria folks, patients, families, parents, everyone was brought around the table and allowed to bring in their insights, their views, because they were going to be using this hospital day in and day out. So we wanted to be able to hear from them. How do we make this such a great experience? Because we already talked about how difficult it is to be admitted to a hospital.
Mm-hmm.
How do we make that experience better for not only the patients and families, but also for our caregivers who spend the majority of their time in a day here? So that was the impetus of taking every little piece that they brought. Something as simple as the kid said, "Can we have ice cream?" Well, sure. Why not? Let's have a soft serve ice cream. It's simple things all the way to what do our surgeons need in the operating room to make sure that they have access to the highest world class equipment so they can have the best outcomes and
Mm-hmm.
everything else in between. And that's kind of how we did things. We really wanted to make sure that when a family comes in, they truly see this as a place where it's more than just medical care, but it's spiritual care. It's wrapping our arms around them, looking at the design of the building where we wanted the best views toward downtown to be our family lounges, where the parents, because they said, it's tough being here, can I have a place where I can go for 10 minutes just for
Mm-hmm.
respite? Let me check my email, check my text messages, and just recharge. Perfect. Let's pick the best places in the hospital with the best views, and let's do that. Parents ask, can we go outside and be able to eat our food outside? So we have an outdoor terrace by our cafeteria where patients and families, as well as our caregivers, can go out there and be able to have that. And so many more examples that I can use. Another one is our neonatal intensive care unit. Our new hospital, we are going from 65 beds in the current Glennon to 90, increasing as we see the future, as we're prescient about what the need is going to be. It's going to be high acuity, intensive care for these kids that truly need that level of care. So we're expanding our ICUs. Our neonatal intensive care unit is going to be much larger. When we talk to our parents, the average uh, days that a parent spends in our ICU is about 29 days.
Mm.
Our current ICU rooms are smaller and none of them have windows. So many of them said, can we have a window so we can at least look outside and see what the weather's like when we're here for a whole month? Can we have more storage so we can bring our clothes because we know we're going to be here? So we took that to heart. All our
Yes.
rooms are much larger, much more uh, uh, cabinetry to be able to keep things. And every one of our neonatal intensive care beds will have windows. It will be the only ICU, neonatal intensive care unit in the state of Missouri that has a window in every one of the rooms. So again, it's an example of listening to our patients, parents, caregivers, and operationalizing that into the design of the new hospital. So if I'm telling my parents what they're looking forward to is we know it's a difficult time to have a child in the hospital, but we will make it the best time it can be based on what we can control.
Mm-hmm. What a treasure. What a treasure for our region, Dr. Randy. But I think it's going to be a
It's
light on a hill for pediatric hospitals all over the country. So
Yes, it is.
that's just
And I
what a
love that.
blessing.
One of the things we always keep saying is that it is truly going to be a beacon of hope on Grand
Mm,
Avenue on the corner of Grand and Shoto. But it's not just a hospital. So when I had the opportunity to come here, and we'll talk a little bit more about, the topic of this, the something extra, and some of the things.
yes.
It's I would say it's a vision that connects to a mission. And we've already talked about what my calling has been. So as had the opportunity to work with our teams and look at what does the future of pediatric care need to be for this city, this organization, and this community. It was truly to create a destination center for care where it was easy access for patients to be able to come and receive the high quality care, but also ease of access. So it's not just a hospital. Now the connection of that is we just had an approval for the build of a perinatal center of excellence inside the hospital. And why did we do that? I just talked about our neonatal intensive care unit with 90 beds. Well, every one of those premature babies was delivered somewhere. So why not wrap our arms around that mother also and be able to give her the opportunity to deliver inside the children's hospital where all the access to those care is in one place and makes it much easier. So we did that. Then we went a step further. We said, okay, we figured out the inpatient side. What about all the patients? We have over 200,000 visits every year in our outpatient clinics. What about those folks? How do we help them? So we just got another approval to build a ambulatory building, a pediatric outpatient pavilion, right next door to the hospital, connected to the hospital. So now you have a true campus where all that care is in one location with easy parking, and the patients and parents can come and get the care that they need, knowing that it's easy.
Yes.
So
So beautiful. Well, yeah. Let me ask you this. Okay, so say we've got a listener
Mhm.
and they're really moved by this episode of the Something Extra podcast today, Dr. Marandi.
Yes.
What is one thing they can do? And I know you guys invite people in to see and you do tours and things like that.
Yes.
But how can they get involved? How can they learn more? What would you say to them?
So as we talked about, healthcare is difficult. If you don't need to access it, you don't want to. But there's so
Right.
much great things that happen in a hospital, especially in the children's hospital, that I think the community wants to be a part of. So we have a lot of opportunities for our community to be involved, be it from volunteering at the hospital and doing different. We have many different things that they can do as a volunteer inside that would allow us to be able to take care of those families and wrap our arms around them, as I mentioned, more than just the clinical aspect of it. The other aspect of it is through financial support. We talked about some of these projects. All of those projects were mainly funded by philanthropy. The outpatient pavilion, the large portion of the hospital and the build that's there. Many of the things that I have the opportunity to be able to do for our kids, it's because people cared and people were devoted to that mission and gave financially. And it doesn't matter if it's $1 or more, it all goes toward figuring out a way to care for kids. So I would love for the community to really see the new Cardinal Glennon Children's Hospital and all of our services that we provide as truly a beacon of hope for them, knowing that hopefully they'll never have to use our resources and services. But in case they do, in case their grandchild needs it, in case their next door neighbor needs it, they can always have the ease of knowing we're here and we'll take care of them. And if they have an opportunity to get involved, we would love for them to get involved.
That's so good. Yes, and I'm thinking, like you said, Dr. Randy, hopefully they won't ever need it. Sometimes we plant trees for people that we'll never meet, right?
That's right.
But these things do not happen without the community
Correct.
getting involved. So, yeah, I would encourage you to, if this has pricked your heart, I would encourage you to really reach out. I've got just a couple of quick lightning round questions for you here. Okay. Your favorite comfort food besides tater tots? And I know you love tater tots.
I do.
I love tater tots too.
So lately, I have to admit, donut holes have become my vice. So
donut holes.
Even for today, for my birthday, they brought me donut holes. So yeah,
Yes, that's so awesome. Yes, happy birthday, by the way. I know that you're going to be celebrating this evening with Andrea, your
yes,
wife, who happens to be a pediatrician,
correct.
and then Rocco and Enzo, your
Yes,
two sons, right? So
yes.
happy birthday.
Thank you.
Do you have a favorite children's book?
Uh, yes, the Giving Tree.
I love The Giving Tree.
I
I can
love
see
it,
it
but
right now. It's a green book.
yes.
Yes,
So
that's
you
a
know, I
great
have
book.
never been able to finish that book, reading it to my boys, because by the time it got toward the last two pages, the tears would never allow me to finish it
Yeah.
because the emotions that book just instills in me is it's wonderful. It's a wonderfully written book, but it gives you a lot of perspective about life in general.
I love that you mentioned that. Yes, if you got littles,
Hmm.
or even if you don't, buy some copies and give to people that do have littles. It's a wonderful. Okay, now I have to ask you this too.
Sure.
Favorite movie, and I know you guys are big fans of you guys are big
Yeah.
Star Wars fans.
Yes, yes, we are. So me and the boys, we are just all we love Star Wars. So we've been so excited about the Mandalorian. That's been the latest thing we watched. So it's
Yes,
everything about Star Wars is big in my house.
I love that. I love that. Um, well, and I also know another thing about you I read. You love hospital cafeteria food.
Yes, yes. It's interesting you mentioned that. So I've grown up in hospitals. That's as I said early on in life when
Yes.
I was there. But then knowing that I wanted to become a physician later on, when I came to the U.S., when I went to college, obviously not having money to be able to make ends meet and to eat, I would volunteer. You talked about volunteering, what people can do. I remember I would volunteer at the local hospital and go in and do whatever they needed me to do. And with that, I got a voucher to be able to eat. So I did that as often as I could. And then later on, medical school, residency, I have become a
A
hospital
connoisseur.
cafeteria aficionado. So yes, I love
You're a
cafeteria food.
connoisseur
Yes.
of, I mean, my father-in-law
Mhm.
worked in a hospital.
Mhm.
The whole time my husband and I, we dated all through high school and college. And so I visited a lot, and the cafeteria food was great.
Food's great.
I love that.
Our food here at Cardinal Glennon is wonderful.
That's awesome. So I'm gonna ask you this, and then we're gonna talk about something extra.
Sure.
Is there a daily habit, Dr. Randy, that you never skip? No compromise on?
Reading. I
Mm,
read something, at least something that every day. I think we talk about as physicians we're lifelong learners, and a lot of it has to be around medicine. But transitioning to the administrative side of things, understanding that there is so much more to this world, and to be a leader than just the clinical aspect of things. I've become an avid reader of something every day. And it doesn't have to be necessarily a book, it can be just about anything. It could be a little blurb let's say, from a book, it could be a title in a magazine, it could be just about anything. But to me, to be able to continuously learn and to make yourself better is something that you just cannot stop doing every day.
that's so good. I cannot remember who coined this, Dr. Randy,
Mhm.
but I remember, I can't remember. I think his last name was Jones. But he said, "You'll be the same person you are 5 years from now, except for the books you read and the people you meet."
Yes.
And I believe that those are how I feel like I've grown,
Hmm.
both professionally and personally, always. So, yeah, I kind of like books too.
Yeah.
um, well, let me ask you this. This is
Mhm.
called something extra. I have to ask you, what do you believe is a something extra that every leader needs?
So having the opportunity to know I was going to be asked this question, I had to discern a lot about that and think through journey that I've had, and really the leader who I am today. Uh, I I would say that I think there's something extra that every leader needs is the ability to create belief. What do
Mm.
I mean by that? So I want to tell you just a quick few minutes and tell you about the story that was the I would say the turning point for me that allowed me to better understand how to be a good leader. And this was early 2020 when we were all holed up in our own houses because of COVID. So at that time, my boys were 6 and 4, and we just didn't have anything else to do. But we decided to get into puzzles, and we started to work with puzzles. And that's when I truly had an epiphany. And I'll walk you through it. You go to buy a puzzle, and you buy it because of the picture on the box. That's the vision. That's the end goal that you want to get into. So you buy the box, you open the box, and now what do you have? You have all these pieces. What's the first thing that we do? We find those special pieces that are the corner pieces.
Yes.
When I think of my team, those are the special people in my team that allow to frame the future. They're there to create the guardrails. They're there to be able to hone everything in. They're the special ones that are different. You build the framework of what it is that you want to build for the future. Then you look at all the other pieces that are in there. Every one of them is a different color, different shape, different aspect. Those are all of our team members. Every one of them is a unique individual, yet every one of them is absolutely necessary to make that future come true. And one by one, you put them in the right place that they belong because they fit into the right place. And when you get finished, you have the final vision that you wanted to have. The vision is what every leader should be able to bring. The belief of every one of those pieces that they belong, they have a special place, and that they need to be there. Because imagine going through and building the full puzzle and you're missing one piece.
Right.
The frustration. So everyone
Mm-hmm.
in that team is important. So that's when I start to think about there's something extra for me for a leader is the ability to create that belief in a future state that people want to be part of, that they see it as a future they want to be in. They understand how they fit in there. They've had they say, again, I'm going back to making sure they're inclusive and you listen to them. And then respecting each one of them, to trusting them that they're going to fit into the model the way it should be. And then when you're done, you have that beautiful picture and vision. So that's when I really start to think about what every leader should bring. It's not about me. It's not about me doing the vision. It's leadership is helping those others understand what that future is, a future that's worth pursuing and that they belong as a part of. That's what I would say the special piece is.
That is one of the most beautiful pictures that somebody has drawn for me of the something extra. Yeah, that is just beautiful. Thank you so much for that. And thank you so much for making the time to be with me today. I cannot wait to share this with our listeners, Dr. Marandi. And just keep doing what you're doing. You're making a humongous difference, as your whole team is. And so thank you for that. I'm grateful that you're in St. Louis. You're a treasure
Thank you
for our
very
region.
much. I really appreciate the time, and it is St. Louis is a wonderful city. It's a wonderful community, and I'm glad that once we get finished with all the vision that we've created, that we will leave a legacy here that many people will be able to use for many decades. And I would feel fulfilled that we did something as a servant leader for others. So thank you for your time.
Very good. Thank you.
Something Extra with Lisa Nichols is a Technology Partners production. Copyright Technology Partners, Inc. 2019. To learn more about this week's guest, check out the show notes at tpi.co/podcast. If you enjoyed this episode, consider leaving us a review. Thank you for listening to Something Extra.